Welcome to Samba Samba. Enjoy the video.
You start immediately. Check the kit is unexpired and intact because accuracy depends on reagents. Open the package and label the container with name and time so results stay traceable. For urine, begin with a midstream sample to reduce contamination. For saliva, use the provided swab and follow rotation directions. Make sure your hands are clean to avoid adulteration. Once the specimen is collected, close the cup and prepare the included dropper, buffer, or cassette for the next steps. Now you process the sample. Measure and add the exact buffer volume the kit specifies because dilution affects line intensity. Use the supplied dropper to transfer sample into the cassette well. Making a measured number of drops ensures consistent flow across the membrane. Wait as directed and keep the cassette flat on a level surface. Tilting changes migration speed. Once you've applied the drops, start your timer immediately so you read the result inside the correct window. Timing preserves the how and why of accurate interpretation. Finish by reading the cassette within the designated window because early or late reads give false impressions. Confirm the control line appears. It validates the test. If the control line is present, the presence or absence of the test line tells you positive or negative for that analyte. After recording results, seal and dispose of materials per instructions to prevent contamination. If the control line is missing or migration is incomplete, repeat with a new kit. This troubleshooting tip.
Thanks for watching. Consider subscribing if we helped you.